So based on our calculation, we would like to recommend to use the 8-hourly interval because vancomycin is a time-dependent drug. A shorter time interval with 2-hour infusion is more recommended for this drug to maintain the concentration of vancomycin with AUC over MIC more than 125. For the administration of IV vancomycin, we will first need to set the intravenous line for this drug. We will first need to set the infusion rate, then inserting the needle at the IV line, followed by starting the IV infusion containing the vancomycin drug to enter into the patient body by a central line. Then infuse IV vancomycin of 1000 mg over 2 hours in 8-hourly interval with infusion rate lower than 15 mg per minute. After administration of IV vancomycin, some monitoring parameters shall be done. Some of the parameter is the continuity from day 1, which include vancomycin peak and trough level monitoring, BUN and serum creatinine monitoring, and also monitoring of patient weight. Some additional monitoring parameter will include the urine output for this patient, which is done by measuring and monitoring urine output of this patient in a daily basis. Next, on the baseline and weekly audiogram is to assess patient hearing issue because vancomycin can cause ototoxicity. Assessment can be done by using audiogram weekly. Risk factor of ototoxicity may include pre-existing hearing problem, any underlying renal dysfunctionality, old age, and excessive peak concentration. Patients shall be checked for sign of phlebitis and extravasation. IV line need to be monitored every 2 to 3 days and change the tubing for both vancomycin and parenteral nutrition with proper cleaning, which is to avoid contamination and also the risk of infection. Vancomycin has an irritating properties that can cause inflammation of the vessel at the injection site, which checking for sign of phlebitis and extravasation is recommended for this patient. Next, on culture and sensitivity is done to investigate organism susceptibility toward vancomycin and also to identify the clearance of bacteremia.